We will likely be wearing facial masks and coverings in public for a while as this pandemic continues. Dr. Jamie Friedman joins us now to break down some of the myths about these masks. Dr. Friedman, good morning. Good to see you.
Good morning.
I
Thanks for having me.
remember the days when this all started. It was don't wear the mask, stop buying the mask. You don't need to wear a mask. And now all of a sudden we're okay, you need to wear a mask, you need to wear a facial covering. What changed?
Well, I think the evolution of this was don't go out and get surgical masks because the doctors and nurses and people in the hospital needed them. And if everybody's not really wearing a mask, then the question becomes, is that actually safer? Because it doesn't really protect you, it protects other people. So now, when we talk about the vast majority of the public wearing the masks, that makes a big difference. So, if about 80% of people in public are wearing masks, you can see a dramatic reduction in the spread of the virus because what the mask is doing is preventing droplets from your own mouth, nose, from coughing and talking and sneezing, laughing, whatever it is that you're doing, from coming out into the environment. So it keeps it from getting on surfaces or on other people.
Mhm.
So if everybody is doing that and keeping their droplets in, basically, then you're going to have less virus out in the community,
If I,
essentially.
if I have permission to be completely honest, and you talk about everybody wearing a mask, not everybody is wearing a mask. Most people are, some type of facial
Right.
covering. But
Right.
I was at a store recently and I had someone who was not wearing a facial covering give me a look like, why are you wearing a mask? And I kind of
Yeah.
stopped at that moment and I'm like, hold up, I'm doing this for you. I'm doing
Right.
this for you.
Exactly. Yeah. I mean, I don't know. I know that there's people out there who think maybe this is somehow impinging on their freedom or whatever. I mean, I think we have to look at this as that we're a community, and what we do affects other people. I mean, that's really the tenet of public health. And so, as a physician, I know that what a lot of people do affects other people. And we can see that in this pandemic. I mean, I think people are becoming more aware of the surfaces they touch and how
Correct.
often they wash their hands. I mean, that's how interconnected we are. We can all get each other sick. And so you're right. When you wear a mask, you're doing it for other people.
Because
And if someone gives you a look, just say you're welcome
well,
and walk
yeah.
away.
I mean, you do your own thing, but the reality is that what we've learned is with these facial coverings that I am putting on or you are putting on, it's not necessarily keeping that virus from me in particular, but are all
Right.
these little water droplets, and I may be asymptomatic, not know, and I'm spreading it. That's what that facial covering is doing, correct?
Yes. So I think what people also need to remember is this virus is so new. I mean, we have years and years and years of information on influenza, for
Hmm.
example, but for COVID-19, we only have a few months. And so a lot of stuff is changing. So it doesn't mean that people were telling you the wrong thing a few months ago or that doctors had it wrong or were terrible people. It's just that we're learning. And we
Hmm.
do know that you are spreading the virus when you're pre-symptomatic. That's before you have symptoms. So you may not know it. And you're most contagious during that time, a few days before symptoms, when
Hmm.
you have the start of symptoms, and a few days after that start. So this is something that we're learning, and the public has to be patient with us as we get more information.
It's not something we're used to doing. I understand
Right.
it's uncomfortable. And when I go out, wherever I need to do my shopping, I have seen the mask slowly in the face coverings to only cover
Yeah.
one's mouth and their nose, your nose is hanging out. Is that a
Right.
proper way to use a facial covering and mask?
It's not. So the best thing to do when you're putting on a mask, I have a little demonstration. First, wash your hands.
Wash your
Get
hands.
your Purell, right? Wash your hands because whatever you've touched, once you're putting the mask on, you're touching your face. And then I don't have surgical masks with me, but I have some of the masks I've ordered for my family. So you're
Okay.
you're going to be getting the mask from the ear loops,
Hmm.
okay?
Hmm.
Because you don't want to be touching the front of the mask, and then you put it on and put it on around your ear loops. And then before you take it off,
Hmm.
don't touch your mask or lower your mask while you're wearing it because especially those people who aren't wearing them, their droplets are getting on the surface, right? So you're going to wash
Oh.
your hands again. And then when it's on your face, you're only going to get it from the ear loops. And then you're going to take it off. Okay. Because if you touch it, you're moving it down, you're moving it up, you're moving it down, you're moving it up. You're getting germs on your hands from touching surfaces or just the outside of your mask. And then you're putting your hands near your face. So that kind of defeats the purpose of having this sort of
Okay.
safety measure.
Good little reminder. I know with the kids, it's challenging. I took my daughter out for the first time just for her to get some air. She's been in the house for
Good.
2 months. I put a mask on her and trying to teach her how to wear it. Is there an age that it's just too young for the
Yes,
kids?
under 2 is a no-no. I mean, they can't do it. It's not going to be safe. It's not a good idea. Babies definitely not. So don't do it for them. And it doesn't have to be a full mask. I mean, you can get creative, get something cute, use their favorite T-shirt that maybe they've outgrown, and you can cut holes. I have another one. This one is just kind of a shirt, and you can see it just has holes on the side. Um, and you can practice at home. You can have their stuffed animals wear a mask so they can get used to it. You can talk to them about how it's important to protect, grandma or people we're visiting from afar, or when we go out into the community. It's important to remember too, when you're outside and you're socially distanced, so you're taking a walk and no one's around you, there's really no benefit to wearing it. So you don't want to enforce that with kids when they are, maybe on their bike and no one's around them.
Sure. So when you're in close proximity with people. Before I let
Yes.
you go, Dr. Freeman, quick answer. How long do you think these facial coverings are going to be around?
I don't know. I was thinking about that the other day, and I mean, we just have to see how things go. And I think even when governments say, okay, it's safe, then the question is the general population going to think it's safe? And then one other thing I really want to quick add is that it's really important that people know that these aren't, if you're wearing them correctly, they aren't dangerous. You're still getting oxygen. And also, it doesn't lower your immunity.
Okay.
Being inside and wearing a mask does not change how your immune system works, and it doesn't get rid of your memory immune cells that you've already developed. We're not being exposed to other viruses right now because we've been socially distanced for so long that there's nothing out there. So being outside without a mask doesn't necessarily help your immune system. It just increases the risk of spreading coronavirus around.
Another conspiracy theory debunked. Dr. Friedman, thank you. I appreciate it.
You're welcome. Thank you.